Good afternoon, everybody. I want to tell you a story, and in the best way of telling a story sometimes is with pictures. So just to warn you, we don't have many words in this presentation today, but what I want to tell you about is the journey we've been taking on community planning in East Renfrewshire. So that's the council and all our partners. And what we've called this is partnership with purpose, because that's what it's about. What are we really trying to do? And I suppose the other alternative name, as you'll hear later on, is so what are you going to do about it? And that's very much the ethos. If you keep that phrase with you right through this presentation, it's about what we're all going to do about it, and it being the area, the problems, the issues, and taking responsibility. So the first thing we looked at was actually to identify what the problem was. You may not have thought in 2008 we had a problem with community planning, because we had just did a Best Value 2 report that was very positive. Our partners were very supportive, and we had no complaints about community planning. Everybody was very positive about it. I should say, just prior to that, I'd just come into East Renfrewshire Council, but had been one of the partners previous to that, and so had been actively involved in community planning. So I have to say there was nothing wrong with our community planning process. We just felt it could be improved. And was it really driving us to improve the area? Was it really delivering what we wanted? Were our aspirations really been delivered by it? So what we did was we charged our in-house team to look at community planning and to go and speak to all the partners and to find out what they really thought. Now, you could do that in a number of ways. You could do questionnaires and a whole load of things. But one of the ways it was done was actually individually going to talk to partners and actually probing them about what they thought, to try and get some honesty, to say what could be better. One of the answers that came back was that the partnership had some focus, but not enough. Now, I don't think in that terms we were unique. I'd been involved in a number of community planning forums, and there was focus, but we were really being very pointed in what we wanted to deliver. We also had too many layers of decision making, maybe not uncommon at times, but we had a number of different decision mechanisms. It also took us quite a long time to make decisions. Sometimes it could take 12 weeks from the beginning of a concept to actually getting a decision, by the time it went through the various cycles of meetings before we got a decision. So we wanted to cut back on that. And you'll not be surprised, we discovered that we had too many meetings. I know there was reviews done of community planning prior to this time, and we weren't alone in having a number of meetings. In fact, we calculated that it took 3,800 hours of officer time just to sustain the community planning mechanisms, which is an awful lot of time. So we wanted to look and see what we could do to reduce the number of meetings and still keep the community planning partnership delivering. You might recognise this slide, hopefully not just now. We also had too many repeated presentations. It wasn't uncommon for me to hear a presentation 3 or 4 times as it went through the various groups. So it could go through a subgroup, a theme group, it could go to community planning, could go through our council cabinet system, could go to council, it could be up at some other partnership meeting. So you could regularly hear a presentation 4 times, when once would have been fine. So what we wanted to do, and what all our partners said, was how can we stop these repeat presentations? Also, the meetings were not about reviewing progress. Very much they were based on presentations, and I think that's fairly common to a lot of the meetings that we go to. So we took the noun, which we think in 2008 described community planning, which was for us a group of public sector partners coming together at local authority level to hold meetings and share information. And I think that was really what it was at the time. And we thought, how do we want to move that forward? I actually think we should really change it to a verb now, because what we want is about a group of people actually doing stuff, working together effectively to demonstrate measurable results. So it's doing. So if you ask me what community planning is now, I don't regard it as meetings. I regard it as a process that's just inbuilt into our own and other organisations. It's a natural way of working. Now, the first thing we had to do was set a very clear strategic direction. If you remember, 2008 was just the start of the single outcome agreement process. We had our first single outcome agreement just been set up as we were doing this review. So that really gave us the focus, and it gave us a very clearly agreed set of joint performance measures, targets, whatever you want to call them, across the partnership. Something that we could all work towards. So we had a sense of direction. So we changed, if you can read it, from the past ways of working to a completely new way, which was very much focused on the single outcome agreement and delivering that. And we set up our system of partnership with purpose. So I'll run through it very quickly and then explain each of the parts in a wee bit more depth to you. So the first thing we did was streamline decision making. We then looked at how we actually deliver. So we stopped focusing as much about the strategic planning, which is important, but also thought, how are we actually going to deliver this? And actually made sure there was people focused on that. We spent more time looking at performance and accountability. And we also spent more time on information and consultation. Now, I should say more time in information and consultation, less time in meetings. So in terms of streamlined decision making, we now have a lot fewer meetings. The actual partnership meets less, the full partnership meets less than it did in the past. We use email frequently to get decisions. For example, if there's no dissent, you can circulate documents round, try and get agreement to email, rather than having a meeting for everyone to come together and to agree a document. So we try and use the most effective communication route. It also means people have got more time to put comments in and to change documents, and then would maybe recirculate it. Our timescales are now down maybe for decision making to about 3 or 4 weeks. So that's quite a big difference from the timescales we had before. What we've also done is, if we've got existing decision making bodies that aren't formally part of the community planning process, we use them to make the decisions. So we're not setting up extra organisations to do that. So it's very, very much streamlined. The next bit is outcome delivery groups. Now, we used to have multiple layers of groups, as many of us do in community planning, theme groups, different groups. What we did is say, what are the groups that are actually delivering, the groups of partners that already exist to deliver that outcome? So we clarified who they were, and for each outcome, we've got 11 outcomes in our SOE, with an outcome delivery group, and they're responsible for delivering the outcomes across the partnership, doing all what they can to improve the delivery of those outcomes. So a very, very clear focus on delivery and achieving the outcomes. These groups are officer only because they are focused not about renewing the strategic direction, but very much focused on delivering what we've already agreed to do. And they are responsible for key performance indicators. Now, this is where I said the alternative name for the process really is, it's so what are you going to do about it? One of the areas in community planning we wanted to put more emphasis on was accountability. So we now have performance and accountability reviews every 6 months, and we go through our performance against the outcomes, and by that I mean pretty hard measures. This isn't a soft meeting where we talk about strategies. This is about where we have the results at 6 months and a year of our performance against outcomes. We've got trend analysis, now built up over 3 or 4 years, and where possible we've also got benchmark information against other community planning partnerships, or perhaps community planning partnerships that have got similar characteristics to ourselves. So we're building that data up. So at the meeting we actually sit, we go through each of the results by outcome and say, usually by exception, what's improved, what's not, and we actually take responsibility. Now, I have to be honest, at the time I was worried that, that what are you going to do about it? Do we all start pointing fingers at each other and say, you're wrong, I've done my bit, you've not done your bit? It hasn't worked like that at all. What really has happened is most fantastic culture. When we talk about an indicator that's not going in the direction we want, everybody sits around and says, so what can I do about it? and people contribute ideas about how we can improve that indicator. And it's actually a very positive discussion. Now, I have to be honest, I was very worried about how positive that discussion would be, but it's a very, very positive feeling at the meeting. The other thing that happens is that everybody at that meeting takes part in the meeting. Nobody can sit in silence, because there's always an indicator that your organisation has an influence over, and we do expect everyone at that meeting to speak up. So you can't go to the meeting expecting to listen to presentations and not contribute. That doesn't happen. Everybody will have to contribute, and I have to say they do very positively to that, and we'll talk about what's happened in their particular area, and maybe talked about what the outside influences are, and then people work together to try and improve. If I give you a brief example of what that means in practice to try and bring it to life. I'm trying to think, I can't quite remember how long, about 18 months ago, we were looking about one of our performance indicators, and it was about looking at older people and the number of admissions, emergency admissions into hospital. Now, we know that's a big problem for us as a cost to the NHS, but in terms of providing good health and keeping older people comfortable and in their own homes, emergency admissions are not a good idea. We know that it's more difficult for them to go back to their home environment, so there's a whole load of issues that affects most of the partners. So we looked at that indicator and realised that our performance was declining, not improving on that. So we talked as a group about what we could do, and our colleagues in fire and rescue said, we're a bit worried. We know there's some older people who are particularly likely to have house fires. We'd like to be able to do more to actually prevent those house fires, and therefore that will help with some of your emergency admissions into hospital. So the group then went away, started talking about it, and we've come up with a project called in our telecare pilot, and that's a joint initiative between fire and rescue and ourselves. We've got community alarms, as most areas of Scotland have. But what we've done is we're working with fire and rescue, we're targeting homes and connecting the alarms up to the smoke detectors, and it goes directly to the CCTV control room. So we've got a lot of services working together. So if there's a fire in somebody's house, sets the smoke alarm off, that immediately goes to the control room. The control room notes an older person with a smoke alarm. They'll have a little bit of information about them. They can do a sort of, try and speak to the person to see if it's a toast, or find out really, is it a serious fire in the house, and call the fire brigade. And we've had examples of that, and I must admit it does work well. We're still in the rollout phase of it. You may be sitting here saying that seems entirely obvious, but sometimes it's entirely obvious things that we miss when we're doing that. If I follow that on with what's happened more recently, we were discussing the success of that, and at the same time the police were telling us in East Renfrewshire we've had an increased number of housebreakings. Hope none of you live in East, well I do hope you live in East Renfrewshire, but I hope you've not suffered a housebreaking. We've had particularly, it could be the recession, it could be a number of reasons, and we were talking as a group how we could reduce the number of housebreakings, and one of the ways of doing that is being ready and prepared. So fire and rescue have offered, when they're doing some of their visits, to look at fire in some vulnerable people. They'll also look at whether they're likely to be prone to housebreaking as well, and tie in terms of community planning to see if the police should go and visit and give them some advice on housebreakings. So what we're trying to do is just join up the service to older people, so to them it becomes seamless between fire and rescue, police, social work, NHS. I should have said earlier that one of the things that has helped us in this journey is we have a joint community health and social care service. So at our meetings, we actually have one director who's responsible for health and social care. So already a lot of our NHS and social work is joined together. We've got joint teams all working out of the same office. So we've already got that in practice. And I think that's really helped us pull together this agenda and common outcomes. In terms of information and consultation sessions, I've realised I'm just about to go over time. I was given 15 minutes, and I see I'm taking it, so I'll be 2 minutes just to finish, or 1 minute. What we've done is we realised it's a small number of councillors got involved in community planning. There's only so many you can have round a table. We wanted to involve all the councillors where possible, so we run information and communication sessions. All the partners come, we run them an hour before the council meeting, and this is the council's main involvement in community planning. We take a topic in which there's an issue, we as partners present, and the councillors are heavily involved in that. I think the success of it is that we've almost got 100% turnout for each of the sessions that we've run. We've been now running them for a couple of years. We've got a very high level of turnout from councillors and involvement. So what are our lessons? Because we believe it's working. We've just done another review with our partners, and again the feedback has been very good, but there's maybe 4 lessons for us. Our outcome delivery groups are delivering very well, but they're not very visible, and it's almost been a bit of a victim of our own success. We want community planning to be the way we work, so if you integrate it into what you do, if you ask somebody, did you do that through community planning, they'll say, no, that's just the way we do things around here. So sometimes we can forget that it is about community planning, so we just want to emphasise that and get a bit more visibility on the work of the outcome delivery teams, and we've got some new mechanisms in place to do that. We want, one of the issues we have got is partner turnover. We've had relative constancy in the council, some changes, not too many, but we have very frequently partner turnover, and that makes it quite difficult if you've got a new partner coming who's used to working in a different community planning way, and then come to our way, which is very, very different from what happens in many areas, and it can just take a wee while for that to come together. We're also aware that although we have very good engagement from councillors, that we need to improve that further and just get the absolute clarity on the decision making. We do have the information and consultation sections are heavily involved in, and all reports the Cabinet and Council get very heavily involved in community planning as well, but we want to tighten that up. So we've got 4 improvement actions that we're working on at the moment. I suppose my message is you need to constantly keep improving what you're doing. Even if it seems to be fine and everybody's saying it's okay, it never is okay if you're not delivering the best outcomes from your area. And what we want to do in this is just absolutely deliver the best we can to the residents of East Renfrewshire and just keep on improving our targets, pushing our targets up and delivering against them. So thank you very much.